childhood acute lymphoblastic leukemia patients after treatment are at a higher risk of premature atherosclerosis. Frequent and severe cardiovascular events have been reported in childhood cancer survivors. Elevated serum levels of endothelium-derived blood vasoactive factors, such as cytokines and adhesion molecules, can predict early atherosclerotic lesions in high-risk patients. Several studies have established that increased carotid intermediate thickness in young adults can indicate the risk of future cardiovascular events like stroke and myocardial infarction. The aim of the study was to assess the risk of premature atherosclerosis in survivors of acute lymphoblastic leukemia based on the serum levels of selected biochemical markers of endothelial dysfunction and carotid IMT measurements, and comparing with persons not exposed to such factors. Patients who had been treated for acute lymphoblastic leukemia and were exposed to anti-cancer therapy at least 5 years before the study were included in the study. Patients who were not diagnosed with congenital heart disease or cardiomyopathy and who were not treated for diabetes, hypertension, or growth hormone deficiency were enrolled. A sum of 100 subjects were included in the study. The all group consisted of 64 patients, and the control group was comprised of healthy individuals. Along with the regular physical examination, arterial blood pressure and ultrasound CIMT was measured. Biochemical analysis was performed to estimate the levels of atherosclerotic markers, including intercellular adhesion molecule 1, endothelial leukocyte adhesion molecule 1, thrombomodulin, interleukin 6, and high-sensitivity C-reactive protein. The mean intermediate thickness index for both right and left carotid arteries was statistically higher in the all group after anti-neoplastic therapy compared to the control group. A considerably higher blood serum concentration of intercellular adhesion molecule 1 was observed in the all group relative to the control group. Significantly higher blood serum concentrations of interleukin 6 were reported in the all group than the control group. Patients who were treated for childhood acute lymphoblastic leukemia exhibited higher concentrations of selected new atherosclerotic biomarkers and increased IMT values, indicating endothelial injuries in blood vessels. These individuals are at a higher risk of developing atherosclerosis prematurely.